Hello, welcome to my infusion therapy training video for dentists. My name is Ian Shelton and I will be your instructor for today. So, initiating intravenous therapy in a dental office can be achieved using proper CDC and Infusion Nurses Society standards, and I will be using best practices and protocols today. So, the first step before inserting an IV in a dental office is figuring out what the indication, what is the need for an IV. It could be surgery, it could be dental trauma if you're an oral surgery center, it could be sedation for a fearful patient, it could be life-sustaining and life-saving medications during an emergency situation, anaphylaxis or code blue. You need to get access, whatever the reason, you need to get access in the vein in the dental chair. And to do that, I will show you all of the required equipment and required steps to safely gain this in a dental office. So you need your IV pole with your IV pumps. If you're going to be using gravity for like a minor procedure, you might not need a pump, but it's best to have a pump for your surgical patients. And it has two sides to hang medications. If you're going to be using a piggyback medication, you'll need a second spot, but today we're just going to do a basic primary. You will need, in this case we're using a trainer, but obviously you're going to have your patient. You'll need an IV start kit. This will contain what you need to clean and bandage the IV and prepare and find the vein. You'll need an IV catheter of the appropriate gauge. For an adult dental patient, you might use a 20 gauge. You might use a 22 or 24 gauge if it was a pediatric. You'll need these caps to go on your IV tubing to keep the ports clean. You'll need a saline flush syringe. This is pre-filled saline, sterile salt water. Optional, you'll need a 2% lidocaine and a tuberculin syringe. You'll need your bag, your fluids. Typically for outpatient surgery, a liter of lactated ringers is good. If you're going to be transfusing blood for a dental trauma, you might use a 500 cc bag of normal saline. You'll need your dental tubing, depending on, this is the tubing that's designed to go with the pump. This one has 3 ports and it's about 100 inches long. It's needle free, so you can screw on a syringe to open a valve on the port instead of having to puncture the port with a needle. So you have your pump therapy tubing. You will need an extension set to connect to your catheter when it's in the vein. You can't just connect your IV line directly to the catheter. You have to have an extension set. This gives it more flexibility at the insertion site to prevent it from getting pulled out when the patient's waking up from anesthesia. And if you need to disconnect the IV to troubleshoot an infusion, if the vein stops working, if it's hurting, this will make it easier, so you can disconnect and you can, finagle the needle to sort of reposition it. You will need, obviously, non-sterile gloves and hand sanitizer. So, patients in the dental chair, you got to get them on a monitor, 5-lead EKG, blood pressure, pulse ox. Cycle the blood pressure one time before you start the IV, just so that you have a baseline. You do not want to administer too much fluid, because that can cause stress on the heart, which can increase blood pressure and cause arrhythmias. Likewise, if the patient's blood pressure gets too low during a procedure, you may need to bolus fluid at a faster rate to get that blood pressure up, and that is why this 1 liter size is perfect for surgery. So you get the patient in the dental chair, you'll explain to them what you're doing. Hi, I'm going to be inserting the IV. Is it okay? Do you understand what an IV is? Is there a specific hand you'd like me to use? Are you afraid of needles? Are you sensitive to pain? Are you allergic to anything? Just basic questions just to get to know your patient. You want to see if they're allergic to certain adhesive bandages or certain soaps and cleansers, because you may want to use alternate products. First, before you do anything with the patient, you want to spike your bag. This is so that once you get the IV in, you get it locked and you get it secured, you have something to connect it to. So you have your pole, you have your bag, you have your primary infusion. What we're going to do first on the infusion line is we're going to shut it off with this little blue wheel right here. We're going to shut it off as soon as you take it out of the packet. Then you're going to unravel the tubing to its full length. The tip is covered so that if it touches something, these parts need to remain sterile. Alright, find the top where the sharp pin is. The pin is going to be going into your bag and must remain clean. This chamber is what you will actually fill with the solution when you get it into your bag. And it's important to close your clamp first, because if you spike your bag, you're going to get turbulence, which causes air to form in the line. You'll get air bubbles, and you'll get a mess of fluid everywhere if you don't control it. So you're going to obviously take your caps off and make this as sterile as possible. You don't want to touch the key parts that are going in. You just want to touch the outside of it when it's already connected. You're going to invert, and you're going to squeeze your chamber until it's to the fill line. Then what you're going to want to do after you spike is you're going to want to hang it up on the pole like that, in that fashion. And then I'm going to take the end of the tubing, the part that's going to screw onto the patient's extension set, and I want to get the air out of it. So slowly open the clamp. It's important to do it slowly so that you can control your flow. And then we're going to shut that bad boy off. And once the fluid is gone to the end, you may want to flick these little Y ports just to get the air out of them, because there may be an air pocket hiding in each of the little ports. So once this entire tubing set is primed, you can go ahead and put it through the pump so that you can have it ready when you put the line. Now your pumps may be different if you're getting new pumps, or if you have a pump, yours may be different. But with this one is Baxter, so it has this little blue key that's going to go into a hole on the front of the pump. So you're going to put it in between the little arms and then thread it up the tubing. You want to make sure that it goes to the sensor so that it can count the flow and look for air bubbles. You want one port to remain above the pump so that you can connect a piggyback, and then you have this little valve that prevents your piggyback solution from going into your primary. So like if you're hanging antibiotics, you'll hang the antibiotics here with this shorter tubing, and then this will just run in as a maintenance fluid. So we got our tubing primed and we got it in the pump. Good. Next, depending on your patient, you're going to drop some lidocaine. Lidocaine is optional. You want to make sure the patient doesn't have any contraindications, any allergies, any reactions that you need to know about. And this is why it's important to check the patient's medical history before you're going to initiate an IV. So obviously, you would pull your air up, inject your air into the vial, and you only need about 0.4 at the most. You're not going to be going very deep, and you're not going to be giving very much. This is only to numb a small portion of skin around where you're going to start the IV. And this needle has a safety device, so when you do the injection and you're done, you're just going to flip this white and it's going to cover the needle. So next, what you want to do is you want to get your extension tubing primed with your normal saline. This is how you're going to test to make sure that you're in the vein, and this is going to give you an extension to connect to when you're ready to start your fluids. A lot of dentists don't use an extension. These are actually required by the Infusion Nurses Society unless it's a true emergency. You just connect it right to the fluids. That's fine, but you may need to switch the IV or put an extension on later. So you're going to push it to get that air out of the tubing line. So now you have your extension, and sometimes in the hospital these are called J loops because you're going to tape it like a J on the patient's hand. So now that the air is out, you always want to prime these because you do not want air going into a system. Anytime you pull tubing out of a packet, it's going to have air in it that you will need to remove. So this is primed. You might want to loosen the cap a little bit so that you can easily get it off when it's in the vein, but don't let the end come open and touch anything. Then you want to get your IV start kit open. And these IV start kits are nice because they have what is required to tape and bandage the site as well as clean the site, because there are certain requirements for that, and it's convenient just to get them in a kit so you don't have to look for them. So what's in these kits, you may ask? Well, you have a soap or a cleansing agent. This one is chlorhexidine, which is recommended. Best practices to use a mixture of chlorhexidine and alcohol. So this is 2% soap and 70% alcohol is what this is. So the alcohol will quickly kill the germs on the skin, and the soap will protect the IV site and keep it clean underneath of the bandage while the IV is in place. And you would break it, so you'd crack the little wings, and that will break the glass, and then it'll get the sponge wet, and then you will basically prep your site for 15 to 30 seconds according to protocol. You're going to want to have your tape ready so that when you get the IV in, you can secure the J-loop. You don't want to put tape on the catheter itself because you will contaminate it. You're going to get your tourniquet out. This kit's going to come with a tourniquet. This is what you will tie on the patient to sort of locate the best vein. I'll take this top off. You will have gauze in case the patient bleeds. You'll have a few squares actually. And then you will have your bandage, and it'll have a label so you can label the size of the IV, the time and the date of when it was placed. And then this bandage has a clear window to go over the site. You never want to put tape directly on the entrance point because you won't be able to see the site. If there's redness, if there's swelling, if you need to discontinue the IV, if the patient's complaining of pain, you're going to have to finagle the needle and take the tape off in order to see the site. This allows you to view the site at all times because it's clear and it's sterile. So, you want to apply the tourniquet. You want to explain to the patient that you're looking for a vein. There's many tips and tricks. You can lower the arm. You can use a tourniquet. You can have them pump their fist a few times. You can apply heat to the vein. You can rub the skin with alcohol to make the veins stand out against the light. There are also ultrasound machines you can use and vein finders that you can use, but those are a little bit more expensive. Your office may or may not have the budget for those. So you'd apply the tourniquet, you'd find a good vein. Once you found a good vein, and it's important to know that it's best practice to use the patient's non-dominant hand if possible. This allows them to move around and do certain tasks when the IV is in place. If they're going to be staying longer, like after a procedure, they may want to eat in the recovery room. It's good to use the non-dominant hand just as a courtesy. So you get this, you find your vein, and next we're going to clean the site. So you break your soap like we discussed previously, and you might want to shake it to release the soap to the end of the sponge. And then once the sponge is wet, we're going to scrub the site in a zigzag pattern for 15 to 30 seconds. And it's important to let this stuff dry because while it's drying, it's going to be killing everything on the skin. So dry time is kill time. So if you're poking while it's still wet, not only are you going to leave germs because it hasn't had time to kill, but also you're going to get soap under the patient's skin when you poke them. That can sting, and that can also cause problems if it goes into the systemic circulation. It's important to explain to your patient the soap is going to be a little cold, and it does sort of smell. It smells strong. So then, once you got it prepped, you're going to set that aside and let it dry. You want to let it dry completely as well because if you put an adhesive bandage over wet soap, it can sort of create a reaction with the adhesive and the soap, and it can cause a burning rash. So then you're going to reapply your tourniquet. And as that dries, you want to test your catheter. You only want to touch the pink part of the catheter and the introducer handle. So you'll hold an IV catheter like this with your thumb and your middle finger, and then you'll use your pointer and finger to advance. So you want to sort of spin that catheter around once on the needle just to make sure that it's loose. You never want to go up and down on the needle, because that can sort of scratch the inside of the catheter and sort of shear it off. So then when you poke the patient, the plastic might be able to go into their bloodstream, and you do not want that. So you made sure that your IV catheter is working. We're going to put it back into its cap, not touching the white part, because the white part, or the catheter itself, is the part that goes in the vein, and that has to stay sterile. So I think our soap should be about dry. Now next we're going to numb the site. This is a very, very small needle, and you'll go in only at a very, very, very slight angle. So you're only injecting under that first layer of skin until you see a bubble, and then when you see that bubble, that's how you know a small area is going to be numb, and that's you want it next to the vein. You do not want it on top of the vein. So you're going to warn your patient, this may sting a little bit. 1, 2, 3, sting like a bee. The gentler you are and the lower your angle, the less it'll hurt the patient. And studies say that up to 70% of patients 70% of patients report a painless IV start with this lidocaine. The other 25% say that the IV was not painful, but that they still felt it. Now that the site is numbed, we're going to take our catheter, and we're going to make sure that our J-loop is close, so when we're done, we can connect this easily. We're going to open our catheter because we already tested it. We're going to go and bevel up at about a 35-degree angle. So we're going to insert it. And you want to warn the patient, you're going to feel a little bit of pressure as I insert, but it shouldn't be painful. Insert. Once you insert, you're going to look for blood in the flash chamber, and then you're going to lower and advance into that vein. Then, once you're in the vein, you're going to pop your tourniquet, and you're going to take your gauze square, and you're going to go underneath of the site. Once you remove your needle, you're going to quickly apply your J-loop. And the gauze is just temporary to catch any blood. You're going to be covering it with a clean bandage anyway. So you're going to sort of hold this in place, and then what you're going to want to do is you're going to want to make sure you're in. Pull back on the syringe and look for blood in the catheter. Once you see your blood and you know you're still in, you're going to push the syringe, and to flush an IV, you're going to push and pause, push and pause, push and pause, and you're going to ask the patient, do you feel any burning as I push the saline? Do you feel any stinging or discomfort at the site? You're also going to look for redness and swelling to make sure that your saline is not going into the tissue. Alright, so we got the IV in. Now what we're going to do is we're actually going to leave the syringe attached while we take our bandage, and our bandage is going to be the first thing we put on our IV just to make sure that it's in. Oh, let me move this out of the way, this clamp out of the way. You don't want to touch the bottom part of the dressing because this is sterile and it's real sticky, so you'll lose that adhesion and you'll contaminate your site. So we apply it. We make sure that the legs of the dressing are underneath of the catheter connection point. And then we are going to take off the paper part of the bandage just to make sure that it's in the right spot. You really want to press the bandage on there so that it sticks. You want to have as tight of a seal as possible because you don't want any bugs or germs or dirt getting into that area. Here we go. Finally, I can get it to peel off. Then we're going to take the second piece of tape from the bandage and we're going to put it on the connection directly to keep this from coming loose. Now that we've secured our IV, we're going to give it one more flush just to make sure that we didn't dislodge it during the bandaging process. We're going to push it, and clamping this lock at the same time will create positive pressure in the line, which is very important so that it doesn't clot while you're trying to connect your tubing. Then we're going to take our tape, and our tape is going to be used to secure the extension tubing on top of the bandage, or on top of the patient's skin. Okay, now that we have this tape like that, this is going to be our saline lock. Now that this port has been used, if you're going to be using it again, you have to clean it off with an alcohol swab before you connect into this port. So what we would do is we would take, here's an alcohol swab. There. So we would take an alcohol swab and we would clean this port for about 15 seconds in a circular motion, just scrubbing the top of that port. And this is needleless, so you do not have to puncture the port. This valve will open when you attach a luer lock syringe. So we're going to clean that and we're going to let it dry. Then we'll take our tubing. And at this point you can explain to your patient that there's no more needles left in the vein, that it's just a little plastic straw. You're going to connect your tubing and tighten the collar. So now this is connected like that. Then, before you go any further, before you inject any medications, you will need to put alcohol caps on your ports. Here, and this tubing has 3 of them. So one in the middle, and then one on the upper port above your pump. And you could do this before or after you connect the tubing. Now we'll need to turn on our pump. It's important to clean up your mess so that the dental chair is clean, the rest of the office is clean, and the patient can go to surgery clean. You also want to label your IV, when you put it in, what size you put in, and your initials, so the dentist or the dental assistant's initials who was putting in the IV. And you will put this next to the bandage just so that everyone can see what it is. Then you can take your gloves off because you're no longer touching the site. And even if you touch the site, there's a bandage over it, so it's not going to get dirty. So we're going to open up our little regulator. And then we're going to go over to the pump and punch in our code to unlock it. And then we are going to put in the rate. So let's say that this is a 1,000 milliliter bag. So 1,000 milliliter bag, so we typed in our volume to be infused, and now we are going to type in our rate. Let's say our rate is 200 milliliters an hour. We will type in 200.0. So now this is running in at 200 cc's an hour. So every hour that passes, 200 cc's will go in. So 2, 4, 6, 8, 10. This bag will go in about 5 hours. And then once you have your pump hooked up, you want to come back to your patient's IV or come back to the dental chair, and you want to make sure that that IV is still flowing and that the patient's not having any pain or swelling at the site. And you want to check this IV site every 30 minutes or so while the patient's in the dental chair, and every 4 hours when the patient's in recovery, just to make sure that this line is running smoothly. And tell the patient to report if there's any pain or swelling, or if they notice any problems with the IV as well, because patients can tell us when we're not around. And this is what a completed IV setup looks like in an oral surgery office. Thanks for watching.